Cancer is one of the most deadly and difficult diseases to treat, but recent advancements in medical technology have led to the development of a revolutionary new cancer treatment, the CAR-T cure. CAR-T is short for chimeric antigen receptor T-cell therapy, which is a type of immunotherapy that uses a patient's own T-cells to fight cancer. But how does it work? When someone is diagnosed with cancer, it's because their cells have started to grow and divide uncontrollably, leading to the formation of tumors. Traditional cancer treatments like chemotherapy and radiation work by destroying cancer cells, but they also damage healthy cells. CAR-T therapy is different because it boosts the patient's immune system to help fight cancer cells. Advantages over existing treatments. Unlike chemotherapy and radiation, CAR-T therapy is highly personalized to the patient's specific cancer. T-cells are taken from the patient and engineered in a lab to produce special proteins on their surface that can recognize and attach to cancer cells. Once reinfused into the patient's bloodstream, these T-cells multiply and seek out and destroy cancer cells. This means that the treatment can be tailored to each patient, which is especially important when dealing with cancers that are difficult to treat, like leukemia. In addition, CAR-T therapy has shown promising results in clinical trials for patients who have not responded to traditional cancer treatments. In some cases, patients who were given just a few months to live have gone into remission and are now cancer-free. Compared to traditional treatments like chemotherapy and radiation, CAR-T therapy has several advantages. First and foremost, CAR-T treatment is highly targeted and personalized, which means that it can be more effective in killing cancer cells. Unlike chemotherapy and radiation, which can also harm healthy cells in the process, CAR-T cells are specifically designed to recognize and target cancer cells. Additionally, CAR-T therapy has shown promise in treating types of cancer that are resistant to traditional treatments. For example, CAR-T therapy has been particularly effective in treating acute lymphoblastic leukemia, ALL, which is often difficult to treat with other types of therapy. On the other hand, CAR-T therapy also has its own set of disadvantages. As mentioned earlier, CAR-T therapy can cause side effects like cytokine release syndrome and neurologic toxicities, which can be serious. Additionally, CAR-T therapy is still a relatively new treatment, which means that it is not yet widely available and can be expensive. Overall, while CAR-T therapy has several advantages compared to traditional cancer treatments, it is important to weigh the pros and cons with your doctor and determine the best course of treatment for your individual case. CAR-T therapy in action. Let's take a closer look at how CAR-T therapy works. The process begins with a blood draw from the patient, in which T-cells are isolated from the rest of the blood. These T-cells are then sent to a lab, where they are genetically engineered to produce special proteins called chimeric antigen receptors, CARs, on their surface. These CARs are designed to recognize and attach to a specific protein on cancer cells, called an antigen. Once the T-cells have been engineered, they are multiplied in the lab and then reinfused into the patient's bloodstream. The T-cells then seek out and attach to cancer cells that have the target antigen on their surface. Once attached, the T-cells release a toxic substance that kills the cancer cells. This process can continue for several months, effectively targeting and eliminating cancer cells throughout the body. Price comparison. While CAR-T therapy is an expensive treatment option, it may be more cost-effective in the long run. Other cancer treatments like chemotherapy and radiation are often repeated over a period of weeks or months, while CAR-T therapy is a one-time infusion. The initial cost may be high, but the long-term benefits may outweigh the costs of traditional treatments. In summary, CAR-T therapy is a promising new approach to cancer treatment that has shown remarkable results in clinical trials. Compared to traditional treatments like chemotherapy and radiation, CAR-T therapy is highly personalized, targeted, and effective in treating certain types of cancer. However, the treatment also has its own set of risks and is not yet widely available or covered by all insurance providers. If you or a loved one are considering CAR-T therapy, it is important to talk to your doctor and insurance provider to understand the potential costs and coverage. And as always, it is important to stay informed and up to date on the latest developments in cancer treatment. Thank you for watching. If the video was helpful, please subscribe and like.